here at ELBC 99.9. I'm always here on every Friday from 10:30 to 11:30, 1 hour. And most of my guests are medical doctors. Dr. Moses Tarawali is no stranger to Flashpoint. He's been here 1,000 times from the Jamali Medical Solutions. And today we're here to discuss a very, very important topic. And that topic is about a new machine called Fluoroscopy. He's going to tell us more about it. Jamali Medical Solutions recently launched that new program at the head office, the Medical Solution. And Dr. Moses Tarawali is here to tell us more about it. During the break, we are going to show a little bit of what we recorded from there, how it works. You look at the machine and see what is being said about it during the program. I'm sorry that we couldn't go live from there because of some problem. They have a situation, a system that Dr. Tarawali is going to talk to you about. So the TV man was smart enough to just turn things around to do the recording. And after the recording, when we got back home, we made sure that it was placed on Facebook and also on YouTube. But Dr. Tarawali is here today to tell us more about this fluoroscopy. Welcome again to Flashpoint, Doc.
Thank you, and hello, listening audience. I'm Moses Tarawali.
Right. Okay. Dr. Tarawali, Jamali has made history again. When I talk about history, there's a time they were the only one that had a CT scan in this country. And then later on, they had what we call an MRI. Then today, we're talking about fluoroscopy. In the first place, tell us what you know about what fluoroscopy is all about.
Well, like I said, I'm Moses Tarawali. I'm a Dogliotti graduate, 1985.
Yeah, that is
class of 86.
Yeah.
I'm a family physician trained in the United States. But long before I left Liberia in 1994, I was fortunate to be doing residency at JFK. That time we had a residency program, even though it's not organized, or it was not organized like the one that we have now with the Liberian College of Physicians and Surgeons. And the new maternity center at that time, that's how we call it, the Friendship Japanese Hospital, had a fluoroscope. And I was fortunate to be the resident in that department. So I used that machine.
Yeah.
And I was just telling you in the room there that I don't know what the status of that machine is. It was a smaller one with limited features, but the one I want to go see it today is bigger with more features than
the one before 1990.
Before 1990, before the war at JFK.
Okay.
So what is a fluoroscopic machine? Fluoroscopic machine is like an X-ray. It's basically an X-ray that combines the effect of an ultrasound. Ultrasound is produced by the machine sending in pulse waves to internal organs of the body. And these pulse waves are then seen on a monitor. So X-ray is static. That means when you take it, it's like a photo.
A photo, yeah.
Whereas a fluoroscope is dynamic. It's moving. And you will see the organs of the body as they move when you're doing the procedure. But it also carries radiation. The radiation risk of cancer in the future is very low.
We're going to come to that.
Okay.
I have that question here. Yeah, I have the radiation thing here, but I want you to just tell us a little bit more. Okay, let me put it this way. I'm glad you mentioned that normally an X-ray is static. It's like you take your picture, you want to see what you look like. But this one is a moving thing. Now, you had a CT scan here not too long ago when nobody else had it around here. But tell us the difference there. How is a fluoroscope different from a CT scan and that of the MRI?
Each machine or modality is made to do a specific type of work. CT scan gives you more detail in terms of tissue and other things, and it is static. It goes through what we call cross-sectional area. So if it is a brain, it's going to take the brain in stations and go throughout the whole brain or the chest or whatever section you're looking at.
Okay.
It goes through sections. It cuts it into splices, and it is static.
Yeah.
Whereas the fluoroscope is dynamic.
And for those of you listening from Douala Demankepe who always follow this program, doctor is saying static. That when he says static, that means you go.
It don't move.
It's not moving.
It's not moving. It's like you get a foundation and you put a foundation down.
Yeah.
It is not the blocks that you're building up that are moving, but the foundation does not move.
No.
So that's what we mean by static.
Static. Yeah.
Whereas something that is moving, it's like water passing. You will see it moving. You see how the stomach is moving.
Right.
You see how the bladder is moving when you want to bring up pee and all that kind of stuff.
Yeah.
So that is what we mean by static, and that's what we mean by dynamic.
Okay.
Yeah. So the MRI is also different because the MRI deals with a different wave. It's magnetic, but it's also static.
Okay.
But they are advanced things that can look into the brain. The disadvantage of, not a disadvantage per se, but the inability of the fluoroscope to do CNS, the brain itself, in a way that you want to see the stomach or the bladder or a woman's womb, is totally impossible with a fluoroscope. So in doing brain studies, you normally would do more of CT and MRI. But if you were to have a person who suffers from what we call stroke, the bleeding in the brain, a fluoroscope would be very advantageous in that it can be used to pinpoint where the blood is, and maybe a catheter or some device can be put in there to suck that blood. A CT scan would not do it. It has to be guided. But a fluoroscope can do it because you've seen where the blood is, and you can just use your whatever you're using to go in and aspirate that blood. So that can be done with fluoroscopy.
Okay.
That's one advantage it has when it comes to the brain. But you can also use it for the spinal cord, and other organs. As we go, we'll talk about that.
Thank you. Now let's talk about radiation. That's my main concern. Most people are afraid to do X-ray in most cases, at most times, because they're afraid of radiation, something harming. What is radiation in the first place? And tell me about the radiation risks when it comes to fluoroscopy.
We are exposed to more radiation from the sun than we do with an X-ray. Seriously, because you're outside the sun all the time. The sun has radiation. Okay? That's why people who do not have melanin can develop skin cancer if they do sun bath too much or too long, prolonged staying under the sun. Now, in those days when they started with radiation, when they started with X-rays, yes, there were a very high risk of cancers coming from frequent exposure to X-rays. But with new technology and with advancement in medicine, the amount of radiation that you get now from a fluoroscope or from an X-ray are very minimal. So for you to really develop cancer in a later life is almost negligible. The second thing is that the benefit of you doing the procedure outweighs the risk of you developing the cancer in a later date.
Okay.
But we get radiation from the sun. That is just automatic.
So, all right. What does this mean for Liberia?
What it means for Liberia is an added advantage in that doctors now can be able to do a lot of things. Fluoroscopy can be used to check whether you have a blockage in your heart.
No, the point I'm getting at is this. We'll come to those details. Most of the time when people want to do this advanced imaging, they travel to Nigeria, Ghana, South Africa, even Europe, where they spend a lot of money. Let me just deviate a little bit. Somebody was crying at the time when they got to the JFK to do cataract surgery. Oh, this thing is expensive. But when they did the comparison with other African places, like Ghana, here you pay something like $350, $500. But then, when that person called his son, I think in Ghana or some other place there, They were talking about 1,005 plus to just do that cataract surgery right here in Africa. But then he said to himself, thank God, so they can do it here, I will stay here. That's the point I'm getting.
Well, it's true that with the advancement of what Jamali is doing and what other institutions are copying, we realize that a lot of people who might be in real need of certain procedures done will not be charged so much in having to go out of the country, especially when the machine is available and the expertise to use that machine to its fullest is also available. Because it is one thing to have the technology, it's another thing to have the manpower to use that technology for its advantage.
You have just answered my next question, but I will still ask you. Yeah, I will still ask you. No, go ahead. When you get to it, I want to ask you about the expertise. Oh, you want me to get through it one time?
The expertise is there. Dr. Wobert, who is our radiologist, as we speak, maybe they finished with the procedure. Because I went to the room this morning to see, like I told you, I've used it before.
Yes.
So I went to see this new one. I was not there when
that was before the war.
Yeah, I was not there. I was not there when they were doing the inauguration.
I was there.
So I went to go see it with my two kolo eye to have an idea of what it is. Because I've used it before.
Okay.
I used it for almost 2 years when I was doing my residency in radiology at JFK.
Okay.
Dr. Wubert is a radiologist, so he knows how to use a fluoroscope.
Okay.
So he's going to use it. Maybe we have an orthopedic surgeon in Liberia who has used a fluoroscope before, and they'll be able to use it. Maybe we have a heart doctor in Liberia, because I know we have them, who has used a fluoroscope before in terms of using it to diagnose heart problem. He might be able to use it. So there are so many advantages of that fluoroscope being inaugurated this gone week.
Thank you. You know, I'm going to still ask a question. You know, sometimes people have a beautiful school building. Like you and I went to SDA way back in the 90s, and I went there mainly because of the uniform. I used to like the uniform. And maybe you went there because of the structure, the building. But we all got to SDA for different reasons. And the only good thing I know is that you and I play football. I used to give you a hard time. I want to declare, I'll give you tough time. Don't deny it yet. So coming back to the Germany issue, Germany, everybody knows that you have professional equipment. They are here. The MRI, the CT scan. But the question now is, do you have the expertise to operate those machines? That's a serious problem in most places. Tell me about your side. You just talked about Dr. Wubert.
I told you, and I will tell the listening audience. The advantage that Jamali has is that we just do not install or bring a machine into the country without training someone to use it. Because it will be like you take a fluoroscope and carry it to Blogonjide, way to the border of Liberia and Ivory Coast, where you have a very sparse population and you don't have anybody to use it. What will happen to it? It will just sit down there and mold will grow and it will become dysfunctional. So like I said, Dr. Wubert, as we speak, and Sammy, the radiographer, were doing a procedure just before I left. I myself ordered a fluoroscopic examination of someone who has been told over the years in Liberia that she got ulcers. But they never looked inside her, that blood test they did, which is normally H. pylori. They say you get ulcers. They get thousands and thousands of people passing nowhere with ulcers. But they don't bleed. They don't pass blood in their stool. But they got the bacteria that can cause ulcers 10, 15 years down the line if you do not treat it. But to tell somebody they got ulcers, you must do either a barium meal or barium swallow and a follow through and see the cavity in the stomach, or you do what we call endoscopy, which is put a camera through your throat and go there and see the soul. But doing blood work, there's no blood work that can tell you got cancer. I mean, you get ulcers in the stomach. So when they do the blood work, it's for H. pylori. In fact, medically, if you want to diagnose H. pylori, the best test is the stool, not the blood.
Now, let's come back to the fluoroscopy something. You are telling the public today that this one is in motion. The doctor will put you down there and will be looking in your whole body as they are doing the
Point of correction, not whole body.
Okay, no, we'll come. I will ask you about the segment issue. Whatever they're doing there, I got a segment thing here that I'm going to ask you about. But the point I'm making is that whatever they're doing there, they'll be looking at emotion.
Yes.
The doctor will be saying emotion.
Yes.
What about the patient? I haven't been diagnosed. Will I be able to see my own stomach and see those things moving in there, or it's only the doctor?
There is a monitor also in the room that they're doing the procedure. There is a screen there. Yeah. I don't know if you saw it that day.
Yes, we saw them.
Then there are two screens outside where the control panel is.
Okay.
So apparently, it depends on the position of the patient. They might be able to see what's going on.
Okay.
Okay. They might be able to see what's going on.
Okay.
But there are many advantages that a fluoroscope has. Okay. Like I said, you can use fluoroscopy for diagnosis. Diagnosis means you finding out what is causing the problem.
Right.
Okay? But you can also use fluoroscopy for procedures.
What is that? What is procedure?
Procedure is something that a doctor does for him to evaluate something that is going on.
Oh,
okay? So, for instance, the lady that I told you about, she came and complained that she's having this gas. And I examined her, she's having gas. So I say, okay, the new machine has been installed. Go there. So she came and she's going to come back on Monday to do her test. Okay? They're going to give her barium sulfate. Some other people will use gastrographin, which is also a dye. Okay. They give it to you and you drink it. All right? You drink the barium. The barium is like butter that has been mixed and put water inside and it will become a little bit, like quicker oat or something.
Yeah.
So they drink it. And you standing there, you're the doctor, you standing there and telling the person swallow. As they swallow, you keep seeing the barium going down. Looking at it real time until it goes straight to the stomach. And if you're doing a follow through, which I ask for them to do, then you allow the barium to pass through the stomach and go to the small intestine. That's what I mean by follow through.
Okay.
The patient will later on pass it in as stool.
Okay.
In the same way, you can also do what we call a barium enema. Especially in elderly people who tell you that, oh, doc, I went to the bathroom and I noticed blood in my stool. So that blood in the stool can be either a hemorrhoid, it can be a cancer or something. So you need to find out what is causing that. Okay. So you give a person an enema, wherein you use a small tube, put it in their butthole.
Yeah, go ahead.
Put it in their butthole.
This is the essence of the show.
Yeah.
You have to explain. You know one thing I love about teaching? I was a teacher and a school principal for 22 years. And one thing I used to like about my teaching, I don't dodge anything. We say it straight.
You got to say it straight.
Without causing anybody. The butthole is the butthole.
Yeah, we call it rectum, but but the Labrian way, you got to do it.
Everybody has to understand.
Yes. So you put a small tube in the butthole.
Right.
Then you put a barium inside, and then you view in motion.
In motion.
As you pump in, you see how the barium is going throughout the big stomach, which we call the large bowel, where the stools are formed. You see it. So you got to get a person some cleansing solution to clean it, especially for people who get constipated.
Is it done in segment or okay? That's the point you were coming to. I already have it here. Now
it depends on the area of the body that you want to fluoroscope.
So it's not just when you go out there and looking through your whole system and.
Like I tell people, yes, like the MRI can do full body. The CT can do full body, but it does it in segment.
In segment, that's the point, yeah. Because it is dangerous, I think. I don't know.
You stay long, when you're doing a full body scan, you stay longer under the radiation.
And that's not good for you.
It's not.
Oh.
But that's seldom you do that for a whole body scan. Okay? But like I was saying, so we've done the GI tract or the stomach and your bullseye pipe and everything.
Yeah.
You can also use fluoroscopy to find out what is going on with your heart. How do they do that? So the doctor who's supposed to do it must be a heart specialist.
Yeah.
Puts you on the table.
I think you're called a cardiologist.
A cardiologist.
Okay.
Put you.
Have them in this?
We got cardiologists that comes to Jamali.
Oh.
So they put you on the table. When they put you on the table, they do a small cut somewhere around here, and they put in a wire and dye. Okay. So that's what we call cardiac catheterization. They send that wire all the way threaded straight through your body all the way. You've seen it in real time until it goes to the heart and the dye goes to the various small arteries that are in the heart. Now, if there is a blockage in one of the arteries that is supplying the heart that is causing this person to be having chest pain, which we call angina or heart attack, then the doctor who is the cardiologist will be able to put in a mesh. It looks like a sifter. We call it stent. They put it in there, balloon it, and it opens up that artery and blood will start flowing again instead of blood being blocked. Fluoroscope can do that. That's the beauty of that machine.
The beauty of the machine.
Then someone who comes in and having problem with pee-pee. They're having problem with pee-pee.
Because of prostate issue or something
For
else.
prostate issue, or they got stone, or they got cancer in the bladder. Fluoroscopy is able to do that.
In fact, you are already answering my next question, but I will still ask you. What are those medical conditions? You can name a few for us that the fluoroscope or fluoroscopy can do. For example, does it detect cancer, prostate cancer?
It does not detect prostate cancer as you might think, but it will show the doctor that there is some mass on the prostate, that there is some mass in the bladder, that there is a stone in the ureters, that the kidney is not functioning the way it's supposed to function. You will see it. But to say that it will say this is cancer, no. But you can tell that there is something that is amiss, they're not supposed to be there. And then you can do further evaluation with maybe cancer markers. They get cancer markers that you can do, which are blood markers, and then you can confirm it. So you can, add to what the fluoroscope is doing. You can now come and say, what I saw in the bladder of this person that looked like, an orange, that looked like, a guava, the size of a guava might be cancer because you've done the markers and it proved that it is cancer.
Jamali is always the first when it comes to these things. We feel good about that, but you tell us how you feel about that, because when it comes to the CT scan, I only heard about it from Jamali. MRI, Jamali.
We're the only one that get MRI in the country right now.
Yeah, but that's what I'm saying. Then you're talking about fluoroscope again. I mean, you're the first. But before you answer that, let's tell the public that this is Flashpoint, the voice of national unity, and I'm David Cote. During the break today, we're not going to play any other thing. What we're going to do for you today, during the break, for at least 5 or 10 minutes, is to show you what we recorded from the luncheon, so that you can see some of the things we're talking about. And we'll continue with Dr. Tarawali, and then you can ask your questions after the break. It's not about playing anything else, but playing some of these things just for you to see the picture of the fluoroscope and to see how it works. So you're always a first. Liberia was the first to have a female president. Liberia was the first to have a football president. Liberia was one of the first, or maybe the first African country to sign the how you call it, UN charter.
The UN charter. We were with Ethiopia.
Yeah, that's right. Always the first. Why? I mean, you're always the first. Tell us how you feel about that.
I feel very proud of being a member of the team, but it also gives Liberians a very big boost, because at the end of the day, Liberia wins. Whatever we do there, whatever doctors we get there, whatever nurses we have, whatever, radiographers, sonographers, everybody, lab technicians, everybody that work at Jamali, the goal there is Liberia wins and Liberia is first.
Yes. We have whatever. Okay.
So, in addition to what we have said about the fluoroscope, there are other things the fluoroscope can do.
Yes. We need to
For instance, we said diagnosis. We can diagnose stones. We can diagnose, enlarged prostate. We can diagnose someone who get ulcers or someone who get cancer of the stomach. Those kind of stuff. You can also use fluoroscope to do procedures.
Okay.
For instance, you break your leg and you need a good orthopedic surgeon to put in a puncture nail, or maybe a rod, or maybe some spikes, or maybe do some clipping, or whatever they want to do. They know what they want to do. The advantage of the fluoroscope is that he will be seeing what he's doing live. Whereas before the fluoroscope, he doesn't know whether he's doing it straight or something. Whether he's approximating the bones properly or whatever. He will have to depend on an X-ray post the procedure and see that you say, oh, boy, you know, in that straight, then I got to go back. But in this particular time, he's looking at what he's doing. When he put in the puncture nail, he's seeing that the nail is going into the medullary, the middle of the bone. It's going straight inside and it's making the bone to be straight. So you can do that. You can also use fluoroscopy, you know, to help put a catheter in someone. Someone comes and they're trying to put a catheter in.
What is catheter?
A catheter is a tube that is put in either part of the body, either in the penis or in the ureter for a female, so that they can be able to pee. All right. Supposing a male has stricture, that means the place where the pee can pass. You now go get sickness from different places, and it becomes rough. It's not smooth anymore, so the pee ain't able to come completely. You don't have prostate though, but this is stricture. You get bump in your toe, and you can't pee straight. Now, fluoroscope is able to help a person insert a catheter easily instead of doing it blindly, because there they will see the ureter and they'll be able to navigate and go in and insert that catheter. Or the person has fluid in their lungs. They got water in their lungs, and when they breathe, it can be painful for them. We call it pleural effusion. And the person wants to put in a trocar or do something to drain that fluid. Fluoroscopy is able to help him to make sure that he's going into where the fluid is and is able to get it. So there are many advantages that the fluoroscope can do.
Now let's do something quickly. I hope we're going to start from the beginning. The public are going to come to you to ask some of your questions, but let's just do this quickly. All right. Please zoom this. If those of you who are watching Facebook now, go to the David Cotie page. Cotie is Kortie.
Good morning, and welcome to this momentous occasion. We at Jamali Medical Solutions are thrilled to celebrate a new era in medical diagnostics, one that promises to bring advanced care and hope to our community. We are here today to inaugurate the Luminous Impulse, the latest in Siemens fluoroscopy technology. Many of you may be familiar with the term X-ray, and in essence, fluoroscopy is a powerful and dynamic evolution of that very same principle. While a standard X-ray gives us a single static image, fluoroscopy allows us to see what's happening in motion. It's a real-time, moving picture of your internal structures, captured with incredibly precise X-ray technology and displayed on a monitor for our physicians. This remarkable capability is achieved with a radiation dose that is actually lower than many standard X-ray examinations. So what does this mean for us? It means we can now visualize the intricate workings of the body's most vital systems with unparalleled clarity. We can closely examine the gastrointestinal tract, the esophagus, stomach, and colon as it functions. We can observe the urinary tract, the kidneys, ureters, bladder, and urethra. And importantly, we can now offer a deeper insight into the reproductive tract, including the uterus and fallopian tubes. This advancement is a critical tool for infertility workup, a significant public health challenge both here in Liberia and around the world. The Luminous Impulse empowers our doctors to provide better diagnoses and more effective treatment plans. With this new technology, we can perform some of the most important fluoroscopic procedures with greater precision than ever before. Procedures like barium swallows to study the esophagus, hysterosalpingography to examine the uterus and fallopian tubes, and barium meals for the stomach all become more detailed and insightful. To achieve this, we use a specialized X-ray setup in combination with safe contrast media, like barium for swallowing or drinking, and iodine-based contrast agents like gastrographin and urographin. Our commitment to safety is paramount. We have invested in the most comprehensive protective equipment available, including lead aprons, gloves, gonad shields, thyroid shields, and eye goggles to ensure the well-being of both our patients and our dedicated medical professionals. We at Jamale thank you for joining us on this incredible journey. The future of healthcare starts now. Thank you.
So in simple terms, it's a super duper X-ray machine.
Yes.
Basically. But way another level, active, like it said, real time. Just watching everything that's happening. Wow. Have you tried it? Like,
Yes.
let's go to that.
Dr. Moses has done it himself. For the patients from the Tesla.
And you're going to be having.
Yes.
Well, of course.
Can we ask a few questions?
Sure.
Yes, sir.
Doc, what's the difference between this and MRI? And also the CT? Even though we have heard it is an advanced one,
Okay.
but what does the MRI do? What does the CT scan do? And what does this one do different?
Okay, so,
The mic said.
Oh.
okay, there are differences actually. Basically, we divide them into two, okay? Radiation producing machines and magnet producing machines. MRI actually uses a magnet producing image, not radiation, okay? This one is a fluoroscopy, is a type of X-ray, somehow advanced than the standard X-ray, and somehow lower than CT scan, okay? So they are completely different, but regarding the advantages, what they do, it depends upon the indication, okay? There are some aspects where fluoroscopy or CT scan or X-ray is stronger than MRI, and there are other issues also. MRI is stronger than X-ray, fluoroscopy, and CT scan, so they complement each other. Yes.
Now, what do you say about the radiation? You know, most people are afraid of doing these things because they don't want something happening in there because of the radiation. What do you say about that?
Okay, actually, fluoroscopy has the lowest radiation than CT scan and standard X-ray. Standard X-ray.
Yeah, you did say that.
Yes, because the imaging technique is continuous. Unlike X-ray, in X-ray, what we do is it's just a shot, okay? Take a static image and then produce an image and then we interpret it. But fluoroscopy, we extend the exposure because it shows a moving picture of the X-ray. So because it's somehow longer than the standard X-ray, the dose of the radiation is very low. It's very minimal, but in addition to that, we have also protective mechanisms, okay? So there are things we call caprons, okay? Lid covered covering. We can see them. This one are lid shields, okay? So this one is about 3.5 millimeter thick lid shield, thicker lid shield. Inside is a cloth, outside is a cloth. Inside there is a lid. So it protects the most important vital organs. For example, if you are imaging the chest, we cover the reproductive organ with this, okay? We also cover the thyroid. For example, this one is called thyroid.
Okay,
So the thyroid is
thank
supposed
you.
to be,
We may come back to show one or two more things, but let's stop here for now and go back to Dr. Tarawali.
We use
Um,
eye goggles as well.
Dr. Tarawali, we'd like to come back to you. The reason for showing this is that we went there merely to have this thing on the internet, on Facebook. All of the journalists that were there, none of us could really get it live because of some, I don't know much, you know about it.
The rooms that you do radiographs or x-rays normally are lead protected.
Okay.
Within the wall, they put in a shield
All right.
so that there will be no radiation coming outside.
Okay.
So once you're inside that room, for you to get any good reception with internet is going to be difficult. And that's one of the things I wanted to talk about too.
Yeah.
Do you need preparation to do a fluoroscopy? It depends on the procedure that you're going to do.
Okay.
If you're going to do a barium swallow or a barium meal, the doctor will tell you not to eat. They will tell you not to eat. There are certain procedures that don't need any preparation. You can just go and go do it.
Okay.
Histosalpingogram, which is a test that is done for a woman who has been complaining that they can't get pregnant. Okay, we call it infertility. It can be either primary, she never born baby before, or a secondary, she born baby, and the age between that baby and her next pregnancy is like 10, 15, 20 years. So for a woman like that who has gone to see a woman doctor or gynecologist, and the gynecologist order histosalpingogram, that can be done. The doctor will see in lifetime what is happening to her tubes, what is happening to her uterus. Okay. That's the advantage of fluoroscopy.
All right.
When you want to do certain procedures, they might either tell you to be, make you to be awake. Some of them, they might either numb you, like the one I talk about, the cardiac catheterization. They will give you some sedative, little things to put you to sleep.
Okay.
But we call it, sedate.
Yeah, but there's one. The example that was shown here in this fluoroscopy, I saw the man standing up.
Yeah, you can do a standing, you can do a lying down. It depends on the procedure that you're doing.
Oh, okay.
Okay? If you're doing a barium, the person has to stand.
All right.
For the barium to go down.
Okay.
So the person can be awake in that instance. But if you're doing orthopedic surgery, where you put in a puncture nail, or you're doing a plate, you're doing something to a bone, that person has to go to sleep.
Okay.
So it depends on the procedure that is being done. You can either be told to fast and come in not eating, or you can come with your belly full. Depends on what you're doing.
Depends on what you're doing.
Yeah.
Now, what we're going to do here now is to see how we can engage the public a little bit. If you're out there, we're not taking a break today by playing any promo. No. If you're out there and you want to participate by asking Dr. Tarawali about some of these things, you please feel free now to call 0-777-511-977 or 0886-511-977. This is a new machine that I think is a blessing to all of us in the country. If you have certain problems and you think you are supposed to travel out of the country to pay some plane ticket, and then you got to go pay a hotel bill, and the charge there will not even be the same in Liberia. It will be very expensive. If you want to do that now, you can ask any question you want to ask. If you have any question or you have a comment, you can make those comments. Let me see what we have here. Oh, I see calls coming back to back now. All right. Good morning.
Good morning, David.
Good morning to you.
My name is Dr. People, and I'm calling from Brazil.
All right.
We will have around one or two quick questions.
Go ahead. Yeah.
Now, how much do you think the machine costs? I want to know, because you've been in the field for a very long time. I want to know.
How much a machine? You say how much a machine costs?
I don't know how much the machine costs.
No.
Do you have an idea?
No.
The reason I asked, whether this is too expensive for DSK.
Oh.
If we don't have, if Jamale is the only hospital
that
has it.
Mama, don't bring politics here. Look. No, I beg you. No. What you do, please ask about how much it will cost to do a particular procedure or test. But this one, but JFK, no. All right. Yeah.
Okay, so if I have a problem that I'm machine will have to do it, what do you think would be the cost?
Okay, good question. Problem like what? Maybe you will tell us later. All right. Good morning.
Huh?
Good morning.
This is Rupa David calling from Puebla.
Okay, go ahead, Mama.
Yes, the same thing you were explaining just now. My daughter is 19 years old now. So I don't have any job for now. She has been wishing going to hospital from clinic to clinic, then doing some medication, and then taking some infection medicine, but nothing happened.
Okay. Maybe they have not found the real problem yet, and that machine can do it.
Yeah.
All right.
Like, can be shaking or like,
oh, you can feel in your stomach like your own shaking. Maybe the machine they're being using not too sophisticated. All right. The dog will answer you. 0-777-511-977 0886-511-977. You have any question or comment, you can ask the doc. He'll be willing to answer you. Good morning. Good morning. Oh, this is not a beeping situation here. You beep, I will not call you back. Sometimes people send text messages. We don't have the time to read them. Ask your question and let the doc answer you. Good morning.
Good morning, sir.
Good morning.
Yes, I'm James Diablo Corey. I got my son, born, a full baby, then they have to, if he is say 2 years now. So I've been going place, but I got no solution yet.
Okay. You will find a solution at Jamali Solution. They call it Jamali Medical Solution. You will find a solution there. All right. Let's try this one. Good morning.
Yeah, good morning, David Goti.
Good morning to you.
Yeah, good morning to our guy in the studio.
Yeah.
Yeah, I want to commend you for the program this morning. I'm so happy to hear.
Yeah.
Because, Mr. Kuti, this is a problem. Most of our people today, we are, going out of the country, Ghana and other places just to go and find solution, to have heard that, yes, indeed, that we got the equipment or the machine, being to the dark place. I think is well commending.
Yeah.
And I really want also to announce his WhatsApp number, because I know that's what many people, because some people will be listening, they don't want to call, or they would want your number. So you can just announce your WhatsApp number, so that someone can get in contact with you, sir.
Okay, while you're on the line, let me call two numbers quickly. The dog may give another one. 0776 60 3000.
Okay.
0776 60 3000. Or 0881 60 3000.
That's Jamali numbers.
That's the Jamali number. Yeah, not the doctor number here. One time I gave that doctor number, he didn't sleep. So I'm not giving it. You can call me. That's my number you're using now to call. You call me, I can give you their numbers personally. But it will put on the radio and the mail when I sleep. So,
that's true.
Yeah, thank you. Yeah. All right. Good morning.
Good morning. How you doing, brother?
I'm doing good.
Yeah, okay, thank you. I joined from the second. My name is John B. Harris.
Okay.
Yeah, I want to know with the extension of the signature.
What? You gone off? Money finished? The line is still on. Well, it looks like they're trying to harmonize him. Well, the line is still true. We're not getting you, so we could take another person. 0777 511 977 or 0886 511 977. That's the number to call to participate this morning by asking the dog in a question, or if you have a comment to make. Let's try this one and see. Good morning.
Good morning. How are you?
I'm okay.
Good. I would like to. My name is Bina Pire. I call from Samukata Obokowa.
Okay, go ahead, sir.
Good. I would like to know as to what that is to do Catholic that makes treatment.
Catholic?
Catholic, when your Catholic have problem, especially from the back.
Oh, okay. The dog will know what you're talking about. I don't have any idea about a Catholic. Okay, but he will answer you. Good question.
All right.
Thank you. All right. Okay, 0777. We can just take one or two more calls and I go back to him. We took part of your call time. We take calls for 15 minutes. We took part of that time to show a video. Good morning.
Morning.
Yeah, morning.
Thank you for your time.
Thank you.
They must be colleagues.
Yes.
Can they receive to perform?
You're still sleeping, Mr. Colley? You're still sleeping? We're not getting you.
Can you machine detect eye problem too?
Oh, good question. Good question.
Detect what?
Eye problem.
No.
No. He said no, but we'll still give you time to. All right. Good morning.
Hello.
Yeah.
Yeah, again, I'm Kevin Harris. I joined from the second to our caller because of my minute.
Yeah, minute finish. Okay, go ahead.
Yeah, okay. I want to know, like, the similar question, he said, what are the machine responsible to scan the entire body to know all the things in the system?
Okay. No. All right. Thank you. We're going 11:15 now. The remaining time is for the doc to respond to one or two things. Doc, you can go ahead. Oh no, please, just 1 minute. Hello.
Yeah, good morning, sir.
Good morning to you.
Yeah, I'm Ezekiel Tisa. I live at Feno. I had a very serious problem in my head. Yeah, it's like because I've been fighting over 8 years now. And the image at the front page of my eyes, with heavy couples of light, produces different colors. I've been going up and down and no other way. Is there any means that he can able to check the head and extract the thing out?
Okay.
That's my question.
Okay, you are the last caller for now because we took about 8 minutes of your time, the callers. So we can't take any more calls and we'll go back to Dr. Tarawali. We may come back to you, the callers. Yeah, you have a few points there, sir.
All right. The cost for the various procedures that the fluoroscope can do range from $110 to $125.
Oh, that's a giveaway.
Yes. They range from $110 to $125. The least is $110. The most expensive is $125.
For the fluoroscope?
Yes. For the woman that called about she had a gap between her last childbirth and presently she doesn't have. Infertility is normally investigated by two sets of doctors.
Yes.
A male doctor will investigate the male in terms of do seminal analysis or sperm count and other things. Whereas the female or the woman goes to a woman doctor who gynecologist who will examine her and then order a hysterosalpingogram, an ultrasound and other things.
Yes.
So she got to go to a real good clinic, not just wayside clinic.
I would recommend her to.
No,
when you say I'm coming, sir.
Let me finish.
Go ahead.
The reason why I'm saying a very good clinic, I know my clinic is top of the line.
The Jamali.
Yes.
Yeah.
If she can come there, she'll be well taken care of.
Right.
If she cannot afford, there are ways that we can arrange with her in terms of payment plan and other things be done. So if she can come, fine. If she cannot, they also want to come, she can go to another clinic, but the clinic must be up to standard. Where they will be able to investigate her properly.
Yeah.
Okay.
And please talk about Nucleoton a little bit. You see, when you talk about charges here now,
Nucleoton is where I'm based.
Yeah.
I'm normally there in the mornings. And the fee there to see me is cheaper than to see me at EAWA Jamali at EAWA Junction.
Yeah.
We do almost everything there, including labs, but we don't do imaging. We do ultrasound there.
Yeah.
We do ultrasound, we do EKG.
Yeah.
But we don't do X-ray, CT scan, and MRI.
At Nucleoton.
You need to come to central office to do it. Yeah. Those prices do not change because you're coming from Nucleoton.
No.
It's the same prices. But, consultation and certain labs are less in Nucleoton than in at EAWA Junction.
Yeah.
The guy that talk about catalytic damage in the back,
I don't even know
the CT scan can do what we call myelography. Myelography is injecting a dye to your back, and then we see the images of your spine and see what is going on. But you have to go and see a doctor that will order it to be done. If it is a real back problem, maybe you need to go to a neurologist, someone who study about the back, the head, and the neck, and the spinal cord, be able to help you with that. A neurologist, there is one in the country. We got a neurosurgeon. There are two in the country, so you can go and see any of them, and they will be able to help you. Eye problems, I don't know if fluoroscopy can do eye problem. I don't even know if CT scan can do eye problem, but maybe they can do small parts, or I don't know. So I won't talk about eye.
No.
Okay? The only two machines I know that can do full body count, but it will take a long period of time, are MRI and CT scan. Like I said from the onset, fluoroscopy has limitation when it comes to the brain. So you will not be able to do something up here, the head. But you can do anything from the throat all the way down to the bones and everything with fluoroscopy. CT scan can do from the neck, from the head, all the way down, but you got to go through series of exposures. Same thing MRI. So those two machines can do full body count, but the money you will pay to do those full body count is unbelievable.
Yeah.
Okay?
Yeah.
Now, the person who has something in their brain or they feel like something in their brain, they need to go and see a brain or a neurologist, a person who study about the brain.
Yeah.
We got one that is coming to us at Jamali.
Okay.
They come there, he will examine them, and if he decides to order a CT scan or an MRI, which is more advanced when it comes to brain, we'll be able to tell what is going on in his brain. Is it a tumor? Is it some mass that is benign? We don't know. So I can't sit here in the studio and tell him what is going on. He needs to seek medical attention with a neurologist, someone who studies the brain. That person will then do examination thoroughly on him and come up with a diagnosis and say, okay, this is what I feel is causing the problem, and then subject him to some investigation, be it CT scan, be it MRI, for us to find out what is going on. Again, the cost of fluoroscopy, the new machine, it ranges from $110 to $125.
That's just one house rent for one room rent for one girl.
Oh, you can rent room for a girl?
I don't know.
I get plenty of girls and I'll be looking for people to rent room for them.
I say that's just 1 year rent for, not even the bigger girls.
This one's one.
Who can go to $10 room. But so I'm just saying here, if you cannot spend that for your own health, don't forget it. We're coming back to you, Doc.
Okay.
Let's just do something here again, very briefly. We'll come to you so you can finalize or close up. Oh, what happened? Did you want to run away from me? No, don't do that. Don't do that. I'm just saying here. All right.
So I'm not imagining the head, for example.
All right.
The other parts of the body other than the head.
What is that doctor's name?
Dr. Wubet.
Dr. Wubet.
So totally right. This is also a lead shift. The other thing is we have also lead glass. Okay.
So he went through the protective mechanism that is built for patient and the people that work there.
Yeah.
Yes, for the patient sometimes for the professional.
So if you're watching the David Cote page, you're going to see exactly what we're talking about.
Germany has professional equipment, but do you have the expertise to operate these machines?
Well, yeah, we have the experts actually to operate the L6 standard.
Do you have a plan for training to increase manpower?
It's always the plan of the management. That's the whole idea. Everything we do is for training. So we have to have, as you know, we have a lot of.
The person you're watching now on Facebook is Mr. Von Baldner, who is the CEO or Director General of NASA.
And also the board chair.
And also the board chair of Germany.
We have to get the professionals to come in here. As you can see, the type of machines that are here is not a trial and error.
No.
Right. And then in the process, everybody's being trained on it to eventually be able to handle it. The whole idea of this place is for eventually to be fully Liberian managed. But until then, we have to keep it going and get the training from wherever we can get the training.
Okay. Let's stop here for now and go back to Dr. Tarawali. Okay, we just play some. Okay, I think we have a caller here. Hello, very quickly. Hello. Oh, if you can't come in, then sorry for you. No more calls. Now, please conclude.
Well, in conclusion, I just want to say this. What are the risks involved with fluoroscopy? One, you can have burns from the dye or, your skin. Two, you might be allergic to the dye, so you can have allergies. And like I said from the onset, there is a small risk of cancer being developed in later life. Then you have pain. Fluoroscopy itself does not cause pain. But if you're doing orthopedic surgery or some kind of procedure that will require pain, will cause pain, then you will have pain. But the device itself, the fluoroscope, does not cause pain.
All right.
So it is the procedure that you're doing that might lead you to pain. And that's why sometimes they give you pain killers, numb the area and do other things. But those are the risks that are involved.
I thank you for being frank. In all surgeries, even the eye. When they were doing my cataract removal, nobody removed my eyeball. It was right there, and they did an extraction of the cataract. But the doctor had to do the numbing of the eye first.
Yeah.
So that you don't feel pain. So in all surgeries, you feel something. So just in 1.5 minutes, not 2 minutes, 1.5 minutes, please tell us what you have to say. But before you do that, let me announce the numbers again. The public may want to go there. You may be having some very serious problem, and your children have told you come to us to Ghana or come to South Africa, or we can find money and send you to Europe. Don't go there. Go to Germany. These are the numbers you can call to get to Germany to do all of these major tests. Number 1, 0776 60 3000. 0776 60 3000. 0881 60 3000. You call those numbers now. If your grandma, your grandpa, or brother, somebody wants to go out of the country, tell them, number 1, plane ticket. And number 2, they can't go alone. They got to have somebody to escort them. Normally it happens. Somebody got to go with you. That plane ticket. Besides that, the risks. The board chairman was joking me in the room that I did when I said, I don't like traveling. He said, but then, how will you be in some kind of country? I'm afraid to travel by plane. I don't like it. Anything can be. And I like car where we check, break, and come back. No way. So the next thing is the charges there will not be the kind of charges you're hearing here. $100, $110. Forget it. You can't find that anywhere else. So please close up.
Again, thanks to Jamali and the management of NASCOP for providing this avenue to be used for patients' care. Fluoroscopy is a modern device that uses X-ray, and it is like a movie you're watching.
Right.
It's like Tofiaka.
Yeah.
Nigerian movies.
Tofiaka.
You're watching, maybe you
see your own heart.
Udochi and you know, but so you see your own heart, you see your own bladder, you see your own uterus, you see your own tubes and everything. So it helps in diagnosis, it helps in finding out what the problem is, and it can also be used to do procedures.
Okay.
It can help to put a catheter in, to suck blood from the brain, to do various things that we can do.
Thank you very much, Dr. Tarawali, for always finding time to be here. We have to leave now. The program has been Flashpoint, the voice of national unity, and I'm David Cote. We'll be here next Friday, hopefully, to talk about hepatitis B.
Again.
Now you need to follow. Yeah, not with you now.
No, just in again.
Again, yeah. If I want a doctor came here, what I would talk about, I'm bringing another person. That's us. That's the man is specialized in hepatitis B issues. So if we don't bring it, we'll bring somebody else. But always follow this program to help yourself. Thank you very much and have a good day. Bye-bye.